Two of our most popular treatments at Nichols MD, Fraxel laser and the Greenwich Secret, are both excellent treatments for regeneration and rejuvenation of the skin. However, these two treatments use different technologies and target slightly different concerns. Many of our patients ask us which of these treatments, Fraxel laser or Greenwich Secret, they should get, when in reality, most people, including myself, can benefit from both. So I wanted to break down here the differences between the two and why both could benefit you. Fraxel laser uses laser technology to create what are called micro injuries to the skin. This allows the body's natural healing process to repair itself and induce collagen production. Fraxel laser is the gold standard for treating a lot of skincare concerns. Number one would be sun damage, those brown spots. Number two would be skin texture and smoothness. Number three would be fine lines and wrinkles. And four, which people often forget, it can often treat acne scars and even small surgical scars. The rejuvenation time or downtime after Fraxel treatments varies for everyone, but it's about 5 to 7 days. And this is where the skin starts to do that little flaking off, but it's not a big deal. It really just comes off in these sort of sandpapery little speckles. And that usually occurs about the third or fourth day and is pretty much done by the seventh day. Now, in terms of who Fraxel is great for, it's great for somebody who is looking to improve or their skin tone, get rid of a lot of those brown spots and sun damage, and who's also looking for the improvement in texture, fine lines, and wrinkles. The Greenwich Secret uses a technology that includes microneedling, which causes those little tiny temporary micro injuries to the skin that induce collagen production, paired with radiofrequency, which is an energy that also induces collagen production in our skin. And the reason we call it the Greenwich Secret is because we add a third component, and that is what we call like a little topical cocktail that we put on immediately after the treatment, which then allows in these little micro channels that were created with the Greenwich Secret, these topical treatments then seep into the skin and then give you a third generation of collagen. Some of the topical treatments that we recommend and use are Sculptra. We also use something called TXA, which helps with discoloration. So there's a number of different topical treatments that we put on top to make it the Greenwich Secret. The Greenwich Secret is great for a number of different skincare concerns. One would be enlarged pores, fine lines and wrinkles, of course, minor acne scarring, and it also can actually give a little bit of tightening to the skin too. In terms of the rejuvenation or downtime involved after the Greenwich Secret, that's the great thing about it. It's almost nil. So you're talking 1 or 2 days maybe. You could be a little pink walking out the door, but even by the next day, most people look pretty normal. And you might have a little, sandpapery skin to the feel, but not much that you would have to cover up. And there's no kind of flaking involved like could be with, the Fraxel laser. The Greenwich Secret is somebody who's looking for improvement in their skin, tightness, also pore size, fine lines and wrinkles, and is also looking for something that has, very minimal downtime. So as you can see, most of us, especially those of us who would reach their 30s or 40s, often have concerns that need both the Fraxel and Greenwich Secret. So for instance, if you have some brown spots, sun damage, but also have enlarged pores and want some increased elasticity, want to treat some of those fine lines and wrinkles, it's best to do both treatments as part of your yearly maintenance. You may have seen on previous posts what I do for my yearly maintenance, and it always includes both a series of 3 Fraxels, on to my second one very soon, and also a series of 3 Greenwich Secrets. So again, most of my patients, including myself, will benefit from both treatments.